APST, Applied Pressure Sensing Technology. APST ensures patient safety, patient comfort, and efficacy of treatment by carefully monitoring and controlling the rate at which pressure increases in the patient's colon during the treatment and ensuring that a safe upper limit of 2 psi of pressure is never exceeded. 2 psi is a safe upper limit for the human colon to hold, set by medical regulatory authorities. To understand how important this technology is in terms of safety, let's take a look at what happens when we attach a balloon to a competitor's colon hydrotherapy device and start water flow. We have the flow control turned to a minimal level. In fact, the water is filling the balloon slowly. The flow rate, often measured in gallons per hour, is very low. However, even at this very low flow rate, the balloon will continue to fill until it bursts. This is what happens when the patented applied pressure sensing technology is not present. Now, let's try the same experiment, this time attaching the balloon to an Aquanet device. We can set the flow rate to a low level, such as 10 gallons per hour, or a high level, such as 35 gallons per hour. The flow rate we decide upon determines how quickly the balloon will inflate with water. But regardless of what flow rate we use, the balloon will always stop filling when 2 psi of pressure is reached. As you can see, simply reducing flow rate to a low level cannot ensure the safety of your patient. For high-level safety, it is necessary to have technology that is specifically designed to sense and limit pressure in the colon to a safe level. A second benefit of applied pressure sensing technology is the greater level of patient comfort. APST monitors the rate at which pressure increases in the patient's colon and ensures that it does not exceed a comfortable pace. This results in virtual elimination of abdominal cramping often associated with colon hydrotherapy treatments. A third benefit of applied pressure sensing technology is that it ensures that the most effective treatment possible is delivered every time. Practitioners who have used competitors' equipment before trying an Aquanet always comment on how much more effective treatments with the Aquanet device are. When giving a treatment with a competitor's equipment, the practitioner needs to use a cautiously low flow rate to avoid patient cramping. They also need to closely watch the pressure gauge to ensure that 2 psi is not exceeded in the colon. But with Aquanet equipment, the practitioner can employ a high flow rate with confidence because the APST system keeps the rate of pressure increase in the patient's colon comfortable. And the practitioner doesn't need to worry about the pressure gauge because APST ensures that 2 psi of pressure is never exceeded. Only an Aquanet device allows the practitioner to use an effective flow rate with confidence. Most competitors' devices are unable to limit water pressure in the colon to a safe level, though some competitors use an electronic valve to do so. This kind of electronic valve creates noise throughout the treatment. Only APST ensures patient safety and comfort while maintaining a quiet, relaxed atmosphere. Applied pressure sensing technology is featured on the Aquanet APS 100 and the Aquanet EC 2000.